All right. Well, welcome back, Dr. Kashyap. Thanks for jumping on this podcast again. It was really fun talking about what you're trying to build last time. This time, I'd really like to dive into what it takes to be a plastic surgeon and really what is a plastic surgeon. It's a name we hear all the time in society. We see it on social media, we hear it talked about in the news, but I don't think most people understand the nuance between the different levels, names, certifications. And I'd love to really dive into that and then kind of fold that back on you and see how you've
Mhm,
grown through the medical community because you have a really interesting experience and
mhm.
background that I think almost overqualifies you for what you're doing now. So let's start with what is a plastic surgeon?
All right. Well, so that's a great question. A plastic surgeon is a board specialty. Okay. It is one of the 24 recognized specialties with the American Board of Surgical Specialties or medical specialties. So to become a plastic surgeon, it is a lot of training. First of all, there is undergraduate, then that most people are doing 4 years. Then after that, you go on to medical school, which is another 4 years. And during medical school, you have to be top of your class, and then you get into plastic surgery, the specialty, and that is another 3 years. There's also another pathway, which is an integrated pathway, which is medical school. After medical school, you go into straight up 6 years of doing like just plastic surgery. When I mentioned 3 years of plastic surgery, before that, after medical school, you have to go do another surgical specialty. Then you do 3 years of plastic surgery. So let me reiterate that it's first there is medical school, then there is a surgical residency, and that could be anything general surgery, orthopedic surgery, oral maxillofacial surgery, urology, it could be GYN. But then after that, you go on to become a plastic surgeon, which is a 3 year subspecialty residency. And in that time, you are learning about everything that is not just cosmetics, because the general population thinks of plastic surgery as cosmetic surgery, and that's not true. That's a common misconception. Cosmetic surgery only represents 5% of what a plastic surgeon is trained to do. So, in that 3 year plastic surgery residency, you are learning about congenital malformations, things like conjoined twins, or cleft lip and palate, or things with hand anomalies, leg anomalies, anything of that nature. You do reconstruction, trauma, taking care of wound care, very complex cases of that nature. I've done a lot of gunshots, burns, reconstruction following various traumatic events. And then, of course, included in that is a lot of training with cosmetic aspects, things that are elective in nature, things like eyelids, face, breast, body, etc. So that really defines the scope of what a plastic surgeon is trained to do. Limb salvage, attaching an arm back on, doing hand surgery, doing reproductive tract reconstruction. So these are all things that a plastic surgeon does, which is not what everybody thinks of. Just think
Yeah,
of
really.
just like,
Nope.
oh, you do boobs and you do facelifts, and that's all they think of. But it's no, it's like a gunshot to the head or a cancer that ate away through your skull and your eye socket. How do you do all of that? So then after that, there's also fellowship training that people can do. And that can be things like, then there is a further, either you could go to a cosmetic fellowship, which is for like, there are specific places around the country that do cosmetic fellowships, or you could go on and do microsurgery fellowship, which is what I did. I did further training to do like pretty heavy duty reconstruction. So that is what a plastic surgeon is. So it's not just somebody who is doing cosmetics.
So it's an incredibly wide area. I mean, I heard you mention all different parts of the body,
Hmm.
internal and external.
Yes.
At first, I was thinking it was just external, but
Yeah.
you mentioned some reconstruction going on the inside. So the entire
Everything.
body.
Like there might be somebody who might have colorectal cancer or a reproductive tract cancer. That leaves what's called a dead space or an open area within the body cavity, and then we have to fill it. So we'll take transpose tissue from either your leg or your back or your belly and move it internally and keep the blood supply. So one of the key things about plastic surgery is blood supply. And that's why it's very important to know who you're going to see, because there are other designations out there. And I'm sure you've heard of people calling themselves cosmetic surgeons. And I really, really want to take the opportunity to really help people understand that they should check out their surgeon, because a plastic surgeon will never say they're a cosmetic surgeon. They will say, I'm a plastic surgeon who specializes in cosmetic procedures.
So,
Okay.
from the inside, then, somebody inside the industry that is very familiar with certain terms that have certain meaning,
Mm-hmm.
what are the different terms that one should be aware of when it comes to cosmetic surgeon, plastic surgery?
Mm-hmm.
I'm sure there's more that I don't know. Can
Sure.
you walk me through these terms and their key and give us some kind of definition or scope around each one?
Sure. So we've talked about what a plastic surgeon is, the extensive amount of training that goes into learning about the multitude of systems, learning how to reconstruct everything from the top of your head to inside your eyeball, your nose, chin, breast, armpit, reproductive tract, back of your knee, feet, hands, all of this. But what that also means is not only are trained how to do the surgical cases, but you're also trained on how to address complications. So that is a key differentiator. There are cosmetic surgeons who may be other doctors, and they may have done some courses and then now they are doing cosmetic work. It is entirely different than what a plastic surgeon is. And a lot of the times, um, the public doesn't know what the training is because it's very key and front and center, like, hey, I'm a cosmetic surgeon. But there's no talk of, well, what was your training? Oh, you're family medicine, or are you internal medicine, or are you, what is your training? You want to have a surgeon who has done plastic surgery residency, who is able to deal with complications. And also, there's a lot of experience that goes with that. Now, there are facial plastic surgeons, and for example, ENT doctors or otolaryngologists, ENT doctors, they are ear, nose, and throat. They have had extensive training around the face, nose. So, them doing facelifts, totally in their wheelhouse. Very, very respectable colleagues. I love what they do. Rhinoplasties, they're just fantastic at what they do. Um, but an ENT surgeon doing body cosmetics, that's really not what they were trained to do. So somebody should really be looking at training. What is their background? Because saying they're a cosmetic surgeon isn't enough. And then the other thing is you want to make sure that somebody is board certified. Now, I had alluded to earlier that there are a number of different boards. There's 24 recognized medical specialties. Plastic surgery is one of them, and it is governed by the American Board of Plastic Surgery. So there are some people who will say, oh, I'm triple board certified. But when they are not one of those specific medical boards, they're kind of like boards that are s- s-
Self-organized over the industry
yes,
to create a board so that you can say that you're board certified. Yeah.
exactly. So there, this is why I caution people to really take the time to understand and look into this and see who your surgeon is and what training they have done, and that they are actually a plastic surgeon who is doing plastic surgery. Because there's a lot of people who will say, for example, you may be a plastic surgeon, but you're not a board certified plastic surgeon. So sometimes in a lot of websites, people will hide their training or their credentials, or they'll say they are board certified, comma, plastic surgery. That one comma means a lot.
Yeah.
They may be board certified in general surgery, but they're not board certified as a plastic surgeon. So you really need to ask yourself, why are they not board certified? Because to become board certified in plastic surgery, it's a lot. There is a whole slew of things that must be done. It's very systematic. There is first and foremost the training, so the residency that has occurred. After you have completed the residency, there is the written examination, which is the entire depth and breadth of everything that was covered for reconstruction, not just the aesthetics aspect. So after you have passed the written boards, now you're deemed fit to be able to sit for the oral boards. Now, the oral boards involves a case collection period where you will be collecting cases. Every single case that you have done for 6 months, you're going to submit to the board and you're going to say, these are my cases that I did. Here are the complications. The board will then select, you need to prepare these X number of cases and submit absolutely everything that happened with this particular patient. Then you go to the oral examination where you have, excuse me, 3 separate oral examinations where 2 of them are unknowns, where you will go and they will hand you a picture. And then from this, it will be like, let's say, pretend there's somebody who had a mastectomy. They had their breast removed due to cancer. Now you have to come up with, how am I going to treat this patient? Everything from medical history, surgical history, smoking status, medications they take, knowing all of the options that you could do for reconstruction and how to help the patient. So you'll have 6 unknowns in that particular room. Then you'll have another 6 unknowns. That's 2 oral board rooms that you've gone to, and you've had examiners who are quizzing you on different kinds of malformations, whether it's a cleft lip and palate. Here's an eye cancer. Here's a gunshot to the hand. Here's somebody who's had a bed sore. Here's somebody with a diabetic foot. All of these things require very critical analysis of the patient problem, the pathology, and treatment. And then lastly, there is another room where your cases that you did, you will be judged on your performance, your execution, and your ethics. So being board certified means you have passed the written boards and you have passed the oral boards, because that is saying that you meet a standard of patient care, ethics, quality, and you're able to deliver this in a safe fashion.
So let me see if I can summarize everything you just shared with us in a very clear manner, and correct me if I'm wrong. Two very similar words: cosmetic surgeon and plastic surgeon.
Mm-hmm.
One of them is a doctor who took some courses,
Mm-hmm.
and one of them had to go through extensive training, had to pass a massive test of the whole corpus of knowledge, and had to have a panel of experts in the field sign off on 6 months of their work, along with analysis and being able to in real time diagnose and talk about different conditions.
Yes, that's absolutely correct. And let me give you my path. So I started off. I did my undergrad. I did 4 years of undergraduate training, and I had a double major in molecular biology and genetics with a minor. I was real fun. With a minor in physical chemistry. After that, I did my master's in immunology. So I came up with a vaccine development protocol for chronic middle ear infections in children. That was 2 years. After that, I went to dental school and I did 4 years of dentistry. Then, being top of my class, I applied for oral and maxillofacial head and neck reconstruction. So there's even a book
I've
That's
heard. I have heard of such a book.
there's a head and neck reconstruction book right back there.
Riveting.
Yes, it's great nighttime reading. So, but in order to get into that super competitive head and neck reconstruction program, you had to be eligible to get into medical school, competitive enough to get into medical school. I did that 6 year residency, did medical school, then I did general surgery. And then after that, I then did plastic surgery, which was another 3 years. And then I decided I really, really liked the entire reconstructive aspect of things. And I went to Johns Hopkins, where I did a fellowship in reconstructive microsurgery, focusing on breast cancer treatment. So that was my pathway to getting fully trained. And after that, then I went on to become an academic at the University of Oklahoma. And I was the first surgeon in the state of Oklahoma to perform super microsurgery, which is lymphaticovenular bypass. So it's a fancy term for very, very, very tiny vessel connections to help with swellings that occur after different things like radiation, cancer treatments. Um, and being a professor, I was bringing up several generations of plastic surgeons, teaching them in the operating room, showing them through the cases that we did, the multitude of cases, taking care of our citizens. I also worked at the VA, taking care of our veterans, restarting the whole head and neck reconstruction program. I walked my residents through complex surgical cases so that they understood, not just with their head, but with their hands, how to perform these surgeries, how to recognize the nuances of, hey, what I'm looking at right here, that's not a blood vessel, that's a nerve. And I have to be careful right here. Or this is how you can very safely and effectively address this particular surgical problem. So I was very blessed to have that opportunity to teach. And then after being a part of the academic world, uh, I had a very intense, clarifying moment where I felt like my desires and what I wanted to offer patients wasn't being met in the academic world. And I'll tell you why. I feel being with a patient is super important, and being present and understanding them is very, very important. I spend time with my patients. I had a woman who came to me, she had just got the diagnosis of breast cancer. She doesn't know what that means. She doesn't know what's to be expected. She doesn't know what kind of surgeries that means. What is the reconstructive pathway? It's just a devastating situation. I got pulled into the office because hospital administration thought I was spending too much time with patients and that I should see 3 patients in the time that I spent with that one. And for me, that was a line in the sand because for me, medicine is about taking care of patients. So that's when I decided, you know what? I'm going to go into the aesthetics world. And that's why I crossed over and went into the aesthetics world. And I was blessed to work at a bunch of different practices where very high volume, where you learn a lot. You get to work with wonderful patients and learn amazing techniques. So, in a nutshell, my training, I was 42 years old when I finished my training. So, yeah, it's been a while.
You opened up a number of avenues there that I want to hopefully keep track of in my head and tackle. One of the first ones though is just really quickly. You mentioned surgery, you mentioned microsurgery, then you mentioned super microsurgery. I have to think in the world of aesthetics, probably specifically in the face, but everywhere, that that training helps you operate at a different level. Can you explain what microsurgery is and then how it goes into how you offer patient care?
Absolutely. I think that's a good pickup because so microsurgery is the definition of microsurgery is free tissue transfer. And what does that mean in common terms? It means taking a part of your body from here and moving it to where it's required to cover up some damage. Okay, because the definition of a plastic surgeon is helping return form and function after some sort of a traumatic event, be that a cancer, congenital issue, etc. Now, you have to provide blood supply. I had alluded to it earlier. Blood supply is everything. And that's why there's a big difference between a cosmetic surgeon and a plastic surgeon, because for us, it's drilled into us. How do I maintain blood supply so I have less complications? Because your eyes can't see what your mind doesn't know. So I was all about doing 2 millimeter blood vessels, connecting them,
Hmm.
and getting blood flow to a large tissue, piece of tissue. How does that translate into my day to day? It means that I look at a problem and I look at the minutia. You can look at a problem at multiple levels, but it's all scaled. If you, just like a math problem, if you don't do the first steps right, the error will propagate. So the same holds true with surgery. And it doesn't even have to be microsurgery. Something like you mentioned face, and I will get to that, but something like breast, for example, somebody might say, oh, that's pretty big, it's easy, it's not a big deal. Just like anything, there are levels of attention to detail um, that really lead to different outcomes. And I think this is where experience comes, knowing that, listen, I have evaluated, I've seen what happens when 1 millimeter of where I put my suture or I connect my tissue versus this millimeter placement, what outcome that has. And you have to be your own biggest critic and be honest with yourself. That's the only way you're going to achieve improvement. And I think surgery should always be about a quest for patient satisfaction, not just with safety, but continuing to get better and better outcomes that makes the patient feel happier and happier. Um, so all of this translates into really understanding things on a small level and how the minutia is going to compound and result in a bigger outcome. For faces, I did head and neck reconstruction, doing facelifts, for example, knowing where are the nerves located, knowing what the complications are. How do you handle tissue? Because, as I said before, blood supply is everything. Being able to handle a skin flap, being able to, as is so popular in the media right now, deep plane facelifts, knowing where are the nerves located for your facial nerve, where's the blood supply, how do I make sure I safely disentangle and remove the attachment points so I can appropriately and safely elevate planes. This matters. And the prime thing is, I know I have so many respected colleagues out there and I respect everybody's experience. The thing that I want to drive home is that patients should feel uh, comfortable with their surgeon, know that what their surgeon has trained to do is in their area of expertise, know that they're board certified, because these things mean something. Being board certified matters. So at the end of the day, all of this training, I can speak for myself. I'm thankful for this very long path that I had, because I did everything from gunshots to the face to like loss of limb to accidents to burns to congenital defects. I went with Johns Hopkins to Vietnam with Duke, and we did nothing but reconstruction from 7 a.m. to 7 p.m. for weeks, and just really had the honor to work with these patients. So I've been blessed with a lot of fantastic opportunities. And this is something I hope to translate into safety and good outcomes for my patients.
There's a known saying that volume creates quality. It's just putting in the reps, right? Making the mistakes, going through time like that. You've got a lot of experience. Can you talk a little bit about your reps, so to speak? How many times you've gone through this? And it could be compared to either people with similar lengths of time of experience to you,
Mhm.
or just peers in practice that you've known.
Sure.
Because I personally know from our conversations the scale at which you've done this, not only the quality that you focus on, but the scale that's behind it that allowed you to create that quality. And I think that that's something that can be really comforting for people coming to work with you is how many times has he done this? And it's an
Mhm.
extraordinary scale
Yeah.
given your time.
Thanks for bringing that up. And it is true. I have been very lucky to be a part of a number of practices where I had the opportunity to work with a lot of patients. Um, as they say, there's that rule of 10,000. 10,000 hours is going to make you an expert. And that is including going through things in your mind, knowing your steps, knowing how you're going to do everything. For me, the benefit of experience is there are no surprises. Um, there's no such thing as a surgeon who never has any complications. Anybody who says to you that they have no complications is lying. They either are lying or they just haven't done enough. And if you look at the lifespan of a surgeon for their career, you will see that as any young individual starts off in their career, they're going to have a level of optimism and perhaps a little bit excessive belief in their skill set, which is understandable. Okay. But as time goes on, you start to face complications and you start to understand how to mitigate them. And as you get further in your career, a more experienced and seasoned surgeon has seen it. They have seen what can go wrong and where to avoid those mistakes. So let's talk about, for example, breast. I have done thousands of breast cases. Face, I've done so much work around the face. Literally, I spent a 6 year residency doing everything head and neck. The complexity of what goes through your neck. There's a funny meme that says this is the worst cable management system in the neck. But the amount of complexity, just think you have your brain connecting your entire body just through your neck. So there is so much that's involved with being able to do that. And the program I was at the University of Maryland, Baltimore, we did everything, including free flaps, doing all the microsurgery. I mean, it was a phenomenal experience. So, repetition of the experience allows you to see where you need to slow down, where you have to take care. And, it's also sometimes people will get complacent with things that are, quote, easy, like closing up. Oh, the facelift, the hard part was like making sure you're in the right plane and doing everything and, moving. The hard part is making sure that you do everything with attention to detail. There's no such thing as the easy part, at least in my view. For me, everything is the hard part because that means you're focusing all the time. You're not like saying, oh, I can relax here because this is easy. No. For the patient, the outcome has to be perfect. So I've realized through experience, you can never just say, okay, now I can relax here. No, you have to be heightened awareness at every single second so that you are saying, this stitch has to be perfect. This has to be placed here perfect. There's a lot of little things that people will miss or not be aware of. And this is why I say credentials matter. This is why I say it really matters who you go to, that you check their board status.
So obviously, looking great is a big part of our society now, right? Part of our culture, part of our trends, part of our social media. Uh, And so there are a lot of people who are going to dig into that. Some because they find value in it, some because they see money in it, some because they want to be part of what's trendy. I think we have a huge flux in the industry, influx of cosmetic surgeons, plastic surgeons. Can you help somebody who's looking for a plastic surgeon to really help them solve some problems? what should they be looking for? What on the website are either red flags, stay away from, like you made the joke,
Hmm.
board certified, comma, like give us that list of things to stay away from and then things to make sure that this person has.
Sure. Okay. Everybody is going to have a different goal of what they're looking for. Some people might be looking for a price point, and sometimes if it's too good to believe, be worried. First and foremost, check somebody's board certification status. Make sure they are board certified as a plastic surgeon.
Can you look that up somewhere or do you
Yes,
have to take their word for it?
you can go to the American Board of Plastic Surgery,
Okay.
look at their website, and see what board are they certified in. And I would say there are some other websites that are like that will check board certification. Be careful of those. Go straight to the source. Go to the American Board of Plastic Surgery and check, are they board certified as a plastic surgeon? Because some places might say, I think there's a website like, am I board certified or not? And it'll say, yes, this surgeon is board certified, but it's incorrect data. It's just kind of like data scraped
Yep.
off of different websites. But as we all know, AI isn't always right.
LLMs don't hallucinate. Come on.
So, yes, it's very important because this is where it goes back. They might be board certified in general surgery, but they're not a plastic surgeon or they're not board certified in plastic surgery. So, I really, really strongly suggest the first thing you do, check, are you boards? Is the surgeon you're looking at number one, a plastic surgeon? Look at their training. Did they do a residency in plastic and reconstructive surgery? Not, oh, they did something else and then they went on to do some training in cosmetic surgery. That is a red flag because they are not a plastic surgeon. So I would be very, very careful of that. The other thing is, um, make sure that you feel comfortable with a surgeon. There's a lot of red flags when there are places where you don't get to meet the surgeon or you don't spend time with the surgeon, where you get an opportunity to feel comfortable with them. For me, I think that's a big red flag. There should never be a situation where you're first pushed into being sold something and then you get to meet a surgeon. I think, and again, that's just my humble opinion, and I respect everybody's business models, and that's fine. It may not be for everybody what I'm offering. But if I were out there and I were looking for something, I would be looking for, you board certified? Do I get to meet you? Do you have good results? What is your reputation? These things matter.
Okay. And let's say you go through that process and you narrow it down. What are some good questions to maybe ask the surgeon to further narrow? Is this somebody that I want to, go through this process with? Do you have additional qualifying questions that could help us find great people to work with?
I think that's a great question. I think that patients should ask a couple of questions. We've already covered board certification. Now let's talk about, how many times have you done this? Some surgeons bristle at the fact, why are you asking me that? Like they get a little offended. And I know my colleagues, sometimes we all talk about things. But from a patient's perspective, I understand that. And I think it's a very valid question. Patients want to feel reassured that you have experience with what you're doing. So, not only as a patient have you already checked out that this doctor, this surgeon has experience and they have training in the valid field, you know, but also I would ask, what kind of complications are there? If a surgeon doesn't go through it with you, hey, this particular procedure, let's talk about, say, a tummy tuck or an abdominoplasty. Well, there are risks that are involved. You could have fat necrosis, you could have a wound dehiscence, you could have a seroma, you could have like loss of sensation, which is normal. If they don't go through risks with you, that's a red flag. Because me personally, I think it's very important that you talk to your patient and say, hey, listen, surgery is a big deal. It's not just an assembly line. It is literally where you are going to operate on a patient. You're going to cut skin. You're going to go through muscle. You're going to do all sorts of work, and it has complications potentially, and you need to go over them. So you have to feel comfortable that your surgeon is aware and ready to discuss these things.
Uh, I come from the business world,
Mm-hmm.
and there we say when making a partnership, that's the best time to think about how do we end it?
Mm-hmm.
How do we think about when things go wrong?
Mm-hmm.
And it's usually the partners that have correctly thought through if everything goes wrong and we end up just not liking this at all, we have planned our dissolution. Those are the ones that last because they've thought through the worst and then it's all upside. And I see a very similar thing. If you have a surgeon who is not willing to talk about the worst and start there and what will we do? How will we address this? How will we be there for you? Walk you through it, holding your hand and figure this out with you. If you don't even have a plan for that, then I'm nervous, right? Versus like, yeah, we can all talk about the good part when
Mm-hmm.
it
Mm-hmm.
comes out perfectly and that's great and we're going to get to that in just a second. Let's cover what happens when it doesn't. I think that's a really really good point and probably an excellent question that everybody should ask. How do you handle when things don't go right?
I will also add, I think aftercare. I think that a surgeon, at least my personal philosophy, and again, full respect to all other surgeons out there, but I'm only going to talk about my philosophy. I think that as a surgeon, you need to be fully involved in every step of the process. It's not just that, hey, I'm here for the surgery. Now get lost, go do your aftercare somewhere else. I think it's important to have a good discussion with your patient to say, listen, these are the things that are going to make your outcomes better. This is how you can have a better recovery. This is the food you need to eat. This is the type of stuff you need to avoid. This is when you can start working out again. You should expect to feel like, like not great for a week. You can expect to be swollen and don't be surprised. So, really going over what the recovery phase is and what's involved with helping the patient through it, those are very, very important things to also discuss.
Well, thank you for helping me understand. I did not understand the variation in cosmetic versus plastic and other
Hmm.
terms out there. I didn't realize, like, I thought
Hmm.
it was minor or just a different residency.
Yeah.
So understanding that is key. The questions helping us spot the kinds of people that we're looking for on their website, being able to check that. I really appreciate you walking us through that today.
Hmm.
Thank you, Dr. Kashyap.
Of course. Thank you. Appreciate it.